Hi, my name is Yava, and I'm coming to talk to you about the cerebral spinal fluid surgery repair that I had done. My surgery has been about 14 months now, and I'm doing amazing. I'm doing really well. I'm thankful that everything was a success. I do have to say that healing took a little bit longer than I thought it would take. I had two options for my surgery in having that. I had an option for them to go through the nasal cavity. The other option was to go through the skull and cut the skull, lift the brain, and then do the patch to repair the leak. I chose to go through the nasal cavity for some obvious reasons. I just felt like that was a better choice for me, and I thought I would have a lesser recovery time, and I did. I did have some feelings about after surgery. After surgery, I thought I would, jump back to my feet and be ready in 30 days. And actually, it took me a little bit longer. After surgery, I kind of felt like not myself, really. A little slower right after surgery, like my equilibrium was off, and it took me a time. It felt like it just took time for my body to reset. And that was a surprise to me. I just thought I was going to, jump back into my activities, and that didn't happen for me. So I wasn't able really to jump back into my activities and feeling normal until about 90 days post-surgery. Also, with the headaches, I did have headaches after the surgery for a little while. I thought maybe that they would have to go into the spine and do that blood patch, but we actually didn't get to that point. The headaches did subside, and I've been maintaining, pretty well. What I do to maintain is a neti pot, actually. So if you don't have a neti pot, guys, get you a neti pot. A neti pot is really good for your after surgery care. I would rinse my nasal cavities out twice a day, in the morning and also at night before I went to bed. And I also had to be careful with that, because when I would rinse out my nasal cavities after surgery, because of the way I chose to have the surgery through the nasal cavity. So, they had to go sideways here in the nasal. So when I do my neti pot, I would squeeze it up my nose, it comes out, but then I had to hold my head sideways, and then the rest will drip out and everything because of the way that they went in. So I thought, like, one day I didn't hold my head sideways, and later on it dripped out my nose, and it just scared the daylights out of me. I thought, oh my God, another leak. But it was me not holding my head sideways to let, all of the neti pot residue come out. So once I got that under control, everything went well. That neti pot saved me lots of dollars on buying allergy meds and everything else. It kept the sinus pretty clear for me. So it's my strong suggestion that if you do not have a neti pot, please go out and get one. And I had the full, not just the neti pot, but the full wash. It's a bottle. And so with that bottle, that's when you hold your head down and you squeeze it inside the nasal, and it comes out the other side. So that really helped me out. And like I said, no leaks. So, I'm pretty happy with my surgery. But I do want to say that sometimes I do have some anxiety, every once in a while, thinking that, is it going to happen again? Will it happen again? I was told that once you have a cerebral spinal fluid leak, that it is possible for you to get another one. So you definitely want to be watching for the signs of something like that happening again. So that needs to be on your radar and everything. So keeping those sinus infections at bay by using that neti pot is what you want to do. Anything to not have to have this again would be my strong suggestion for you and everything. And as I can say, I will say 1,000 times over and over, please, please, please if you suspect that you're having a cerebral spinal fluid, you need to definitely get a sample of that stuff coming out your nose. You need to go to your ear, nose, and throat doctor. Make sure that they test this. They may not even, I was told many times that no, this is not what's going on and everything. And it was from the very beginning. From the very beginning. Trust your instincts. Talk to your doctor. If you have a doctor that don't listen to you, find a new doctor. It's very important that you have someone that's paying attention to your needs and that are actually listening to you. It's your insurance, guys. You pay for this. You pay for your tests and everything. You pay for this insurance, and you pay for your doctor to take good care of you. And so you want to make sure that if you suspect that you have this, then get that test. It's a simple test that they can do to test that fluid. So sometimes you have to insist on that. And sometimes people don't even have a leak. Come to find out that this leak happened, pretty far back before it started dripping from the nose. I was having those headaches and everything. And I had a CT scan a year before. And when the doctor that performed the surgery looked back, he was like, wow, 20/20 hindsight. That happened. Long before that, the leak started coming out the nose and everything like that. So some of this, I feel, could have been prevented if I had some good doctors that was willing to look outside the box and not think that everybody walking through the door had a common issue or it was the same issue as everybody else. One sinus infection means all of us are having sinus infections, or whatever is typical of one person is typical of another. So I'm praying that we get back to the time when we actually, doctors start caring about the patients that they're actually treating, instead of worrying about a cattle call, treating us like we're cattle, in and out, in and out, in and out. So definitely take care of yourself. Remember, it's your health and it's in your hands. I hope this helps everybody. Thank you. Have a great day.